welcome. So I'm going to be introducing Dr. Erica Johnson. Dr. Erica Johnson is a rehabilitation psychologist, epilepsy researcher, and a fellow of the American Epilepsy Society. She has trained and practiced as a clinical rehabilitation psychologist in hospital, outpatient, and private settings for over 2 decades. Since 2008, Erica has led the University of Washington's work with Managing Epilepsy Well Network, also known as MU, one of the CDC Prevention Research Center special interest projects. As part of MU Network, Erica and her team implement the program of active consumer engagement in self-management in epilepsy, also known as PACES. PACES is a training and education program that provides adults with active seizure conditions the tool they need to manage their conditions effectively. Please welcome Dr. Erica Johnson.
Hi, everyone. I'm going to introduce Beck Reyes. Beck Reyes is a pediatric nurse practitioner at the UCLA Mattel Hospital, where she treats patients with complex forms of epilepsy. Her clinical interests include transitions of care, ketogenic diet, and epileptic encephalopathies. Her research interests include self-management and health-related quality of life. She is the co-investigator in the CDC-funded PACES program that is in development for adolescents with epilepsy.
Thank you. Thanks. Hi, everybody. Thank you for joining us this afternoon. Beck and I are going to be talking about PACES and hopefully make this a fairly kind of interactive experience for you all, especially since we're post-lunch. So I'll get us started by just giving you a little bit of an overview of what we'll be up to. So now that we've had the chance to be so kindly introduced, we'll talk to you a little bit about what epilepsy self-management is, and we're curious to know kind of how familiar this is to you. And we'll then talk specifically about PACES and give you a little bit of a taste of what a PACES session is like.
And we don't have a mic in here because there's 2 of us. So if we're not speaking loudly enough, will you let us know? Eric and I know how to turn our volumes up. We're just musing about how we have some pre-teens and Erica has a teen.
Yeah.
So oftentimes we're turning that level of our volume up, especially because my son always has his headphones on when music is there, which I know some of you can relate to. Please just let us know.
Perfect. Yes, we can bring the mom voice. So just out of curiosity, how many of you have heard of epilepsy self-management? Is this at all a familiar term?
They are recording for YouTube, and if you don't speak in the
Thank you. No one can hear us on YouTube land. No apology needed. Thank you so much for clarifying. Yeah, that's super helpful. We would have been really disappointed if folks couldn't hear this later. So just as a way to kind of help us understand who all is in the room and where to tailor things, how many of you have heard the term epilepsy self-management before? Few. Excellent. Okay. Anybody want to take some stabs on what's it about? What do you think epilepsy self-management is or means? Yeah. Excellent, spot on. Yep, so things like knowing how and when to take your medication, knowing what kind of epilepsy or what kind of seizures you have. Absolutely. Any other additions? Yeah. Yes, absolutely. Managing your appointments, getting there, seeing the right person. Yep, yeah, absolutely. Being aware of your triggers. Yep, knowing if there are certain things that are going to set off a seizure. Yeah.
Being able to communicate what's going on with your body to your practitioner and just advocate.
Absolutely. So communication, self-advocacy, those are big parts too. Yes. Yep, medication compliance, yep, so we'll either hear it that way or adherence, right? Like adhering to the schedule or the plan that you have with your provider. Well, is our job
I
done
think we
here?
have really great answers, and I was
Yeah,
going
we
to say
do.
that our job is done here.
Yes, that's amazing. Well, to affirm what you've said, the way that we scientists tend to think about self-management falls into 3 domains, and I think you all just hit upon them in one way or another. So one is understanding that we think of it as the medical management, right? So everything from dietary therapies, medications, knowing when and what to take, and whether that's a medication or like ketogenic diet plan, that type of thing. Another falls into the realm of behavior. So behaviors that are helpful for managing your epilepsy, whether that's exercise, whether that's behaviors to help manage stress, communication, we think of as a behavior, right? How do I talk about my epilepsy or communicate my needs to people? And then the third domain has to do with emotional adjustment. How do we navigate and learn how to make an impact with ourselves with emotions, especially negative emotions that might come up either from day-to-day life or as a result of managing a chronic disease. So give yourselves an A. We've got a list here on the slide of the different managing epilepsy well-established epilepsy self-management programs. And just show of hands, how many people in the room have heard of any of the programs here, whether it's PACES in epilepsy, Project Uplift, Hopscotch, SMART, Mindset? Okay, so some familiarity. I think this really means we're in the right place, because hopefully you walk away with more information now, especially about PACES, but knowing that these programs are out there and what they're about. Do you want me to take this part? Do you want to talk about that? Okay, all right, good deal. So we're going to do a little bit of an experiential component today about PACES, and before we do that, I just want to give you an idea of how this program came to be, especially because it is the program in the Managing Epilepsy Well Network's suite of self-management programs that is 100% consumer generated. So back in 2008, when we started kind of putting our heads together about how to make inroads in the area of epilepsy self-management, my colleague and I noticed a couple things. One is that we noticed most programs that were out there were developed in what we call a top-down approach, meaning providers kind of get together and decide these are the problems we see our patients having, so this is what they need to be educated about, and then a program gets developed from that point of view. The other was that when we looked at randomized controlled trials, so experiments of behavioral interventions, up to half of the people enrolled in the interventions would drop out. And we thought, if we build something that's based on what patients say they want, will we be better at meeting their needs, as evidenced by how well they stay in the programs and the kinds of outcomes, the things that change for them after the program. So we've done a lot of survey work and focus group work, and what you're going to experience today with PACES is based on a lot of consumer survey data telling us that not just the content is what people want, but how this is developed, or how the program sessions are deployed, essentially, is what people want as well. And we've engaged in that same process as we've adapted the program for people who live in rural areas of the U.S., for veterans, for Spanish-speaking individuals, and most recently, thanks to my partnership with Beck, with teenagers. And so we've learned a lot from teens about how to make this program tailored for them. To give you a little bit of a broad overview of what PACES is, now that I've been talking to you about self-management and what it means and some of the programs in the MU network, this is an 8-session course. It's a group course where we bring anywhere from 6 to 8 people with epilepsy into the course. It's led by an epilepsy professional who may or may not have epilepsy, and probably most importantly, a trained peer who definitely has epilepsy, who is there to really represent that insider perspective of living with epilepsy. And on the right-hand side of your slide is the listing of each of the 8 sessions. And this was built around what people say are their problem areas managing epilepsy. And this is everything from knowing medications and seizure types to being able to navigate just managing stress and the blues, mood ups and downs, and when things kind of get in the way in life, but also dealing with cognitive changes that come from living with epilepsy, assertive communication strategy, so how do I disclose my epilepsy and do that effectively to have my needs met? How do I get engaged in my community and manage my health and well-being, as well as become an effective partner in my healthcare team? All right, so with that knowledge under your belts, we thought that what we would do is do a little bit of our second session of the program, which is our first of 2 modules on managing stress and the blues. And so I'm going to be presenting a model around how stress and the blues come up for people, especially in the context of living with epilepsy. We're going to do some discussion and kind of show you how this model works and hopefully make this relevant for life experiences that you've had. The reason I'm showing you a couple of these pages is that PACES, when you come into the program as a participant, you get a workbook that has all of the information in it, a place for you to take notes, a place for you to be able to highlight and remember information. And so this is the chapter, if you will, on managing stress and the blues. You want to talk about this first part, or do you want me to keep going?
You can keep going.
Okay.
Before we get into the teams.
Okay, all right, good. So I think one of the key things that we like to start off talking about with people, especially in the arena of stress and the blues, and we're really purposeful about using this terminology for a couple of reasons. This is what people with epilepsy told us they want to hear about, but also we can encounter day-to-day stumbling blocks without it being full-blown depression or without things being an anxiety disorder, right? There's plenty of ups and downs in life that fall kind of within different strengths, if you will, of concerns. What we know for people living with epilepsy is encountering issues around stress or feeling blue or down is more common than it is for people who don't live with epilepsy. And it's not a oh, my life stinks because I have seizures kinds of issue, right? It's not a poor me kind of issue. We know that these things come up either because of the way that medications impact our brains or because of behavioral changes that are required in order for living with epilepsy. Sometimes seizures themselves change brain chemistry and have an impact on mood and on stress management. So there's a stronger and different connection there when we're living with epilepsy than not. And so for that reason, this is an important kind of area for us to be ready to talk about in a program. And we want to talk to you and teach you about a model that really kind of breaks down issues around stress and low mood that focuses on negative events or events that have a negative impact on us, our reactions to those events, so the thoughts, the ideas, the images that are kind of our first reaction to something happening, and the emotional consequences. And hopefully what you're going to see as we talk about this is that there's a way to kind of isolate each of these areas and think about how to positively influence a change in your mood.
So I think we have a good mix of adults and teens in here, which is
Yeah.
really great.
Yes.
And I think I would love to hear maybe from one of our teens and maybe use an example from something that they might have found challenging.
Love it. Good idea. Does anybody have a personal experience, especially if you're a teen, that you can briefly describe to us? So, take a half a minute to describe something. We'll take liberties with your description and kind of embellish for the sake of teaching, but does anybody want to talk about something maybe stressful or challenging that's happened? And it can be related to your epilepsy or not. Yeah. Okay. Okay. Yeah. Do you want to rephrase, just so that everybody can hear it and they get it for the YouTube?
Yeah, perfect.
Thank you,
So
that's
I
great.
think what you were sharing with us is that recently you had a laser ablation, and during that time, it was kind of a lonely time because you didn't really have anybody to talk to during that time.
Love it. Okay. I'm going to take liberties with your description as we go through this process to kind of embellish things, mostly to make a point. So forgive me if I end up saying things that were not perfectly true to your experience, but I'll do my best, okay? What we've got up on the slide here is something called a thought diary. And hopefully this is accessible to most folks. This is like a worksheet style that's divided into columns. And the reason we're asking for an event, and thank you again for volunteering that, is that anytime we're running into a stumbling block where we're feeling really down, stressed out, upset about something, this can help bring some structure to kind of assessing or analyzing the issue and getting more into what might be causing the problem. And where I like to guide people to start in this is to start over on the very left-hand side of the chart. There's a column for describing an unpleasant or stressful event. And this was perfect. All you've got to fill in this situation is writing in, having laser ablation surgery 3 weeks ago, right? That what you're looking for when you're doing this for yourself is filling in kind of the who, what, when, and where types of details. So we just want to get, I have a patient who loves to say, facts, not feelings. We just want the details, the specifics of the event, right? And the reason for this is it lets us kind of set ourselves up to think about what was going on at the time that the event happened. You want to take the next part?
Where are we?
We're on, so then the step 2 is to note your emotions around the event.
That's right. All right. So we're noting the emotions that we felt during that time. And so at the time, it felt like loneliness. Were there any other feelings that you think you might have felt at the time? You might say, for some folks, they might say that they felt angry. They might say that they felt sad. I mean, any emotions that you might have been feeling at the time of that event, it's important to explore those feelings and note them down on your workbook so that you can kind of look back at those events and know what were triggering emotions.
This could be disappointment that the experience wasn't what you thought it could be. It could be frustration. It could be relief, right? We can also have mixtures of emotions too, where we might experience some relief, but also some sadness. So all you're doing is just noting down these feelings words, right? Whether it's frustration, isolation, loneliness, relief. Those are going in, and you're going to notice that I'm jumping across the worksheet here, right? So I'm coming into the column that's about second from the left to note the emotions. And the reason we're doing it in this order is because we're going to come in kind of into the middle of the table, but sometimes that's a little harder to get at. if we can start with the event, the challenging event, and the emotions, that lets us kind of know where we're headed in from there.
Another thing we want to note is we want you to rate your emotions at the time, right? From a scale of 0 to 10, where 0 is like, it's not really a big deal, and 10 being the worst possible feeling that you can have. So it's important for you when you're reflecting on those feelings to think, well, on a scale from 0 to 10, how bad was it?
Exactly, that intensity is going to give you another indicator because we're going to look for, does that change through the process? So then next, you want to note any physical symptoms that come with the experience you're having. So for some people, that might feel like muscle tension or stomach pain or headache or trembling. Anything that you're noting physically that's going on around the experience. And just want to emphasize too that sometimes we can be most effective in doing all of this after the experience has passed. Sometimes when you're right in the middle of something, it's actually really hard to kind of be able to suss some of this apart. So if you're thinking about maybe something that's happened in your own life, it can still be very relevant to sit down after the fact and think these kinds of things through. The next part is, I think, one of the interesting areas. This is the part that we're going to try to work with the most. And it's the reaction or those like instantaneous automatic thoughts that come to mind while you're in the experience. So this may have been something like getting home from the hospital after having the ablation and feeling flat, feeling isolated, feeling lonely, and making note of what kinds of ideas are going through your mind, whether that's nobody's calling me. Why don't my friends call to check in on me? This stinks. I don't feel any different than I did before I went in. Right? Any of these ideas are really important, and it's I think important to be able to kind of separate that these are ideas. They're different from feelings. So even if it's I feel so alone, that's still a statement that you're saying to yourself, right? So sometimes this can get a little tricky. But the idea is, what are the kinds of statements, or it can be images, visions that are going through your mind around the situation. If you're having trouble with this part, and again, I'm going kind of back to why we come into this part last, is sometimes it actually can be difficult to get at what are some of the core ideas that are in the mix with all of this. So we've got a list of questions that we like to walk through, whether it's, what ideas went through my mind as this was happening? Or what does it mean about me? Or what does it say about me that this has happened? What does it mean about me that I've come home from my laser ablation and I don't feel very different and I don't feel very good about it? So different questions you can ask to help get at some of the ideas that are going through your mind about the situation.
I think because it can be tricky where you kind of have a mental block when you're thinking, gosh, what were my thoughts behind these feelings that I was having? And so it's helpful to look over the questions right here and ask yourself these questions to kind of jog your thoughts about how you felt about a certain situation.
The other one I like is, what am I afraid might happen, right? Because sometimes the event itself might be kind of benign, but we might get really stirred up fearing what's going to happen because of the event.
Does that ever happen where you kind of think of all the what ifs and the worst possible situations, and you kind of convince yourself that this is what's actually happening? Does anybody ever feel that way, having those thoughts?
Where the event itself might be not so terrible, but our thoughts get going, and suddenly that event is seeming a lot worse. As we were preparing today, Beck and I were talking about different experiences like this, and I was sharing that I had recently been at a talk where a colleague started off by describing a scenario where she had come in from a busy weekend. She's married, has 2 young kids. They'd been away for the weekend, came home late Sunday night, and they've got kind of a routine for how they do things. Monday morning, They're up early, everybody's exhausted from a busy weekend, and she and her husband have a routine of dividing and conquering, so one took off with one kid for school and the other with the other kid. And all of a sudden, she gets a call from her husband saying, "What's the deal? We just pulled into the school parking lot and nobody's here." And my colleague realized that she pulled over in her car and was looking, trying to figure out what was going on, and she had missed putting a school holiday on her calendar. Okay, stressful, right? Because, okay, what am I going to do with my 8-year-old? But where you can kind of go in your mind with this, it can, get into way bigger of a cloud than an event like, okay, we're going to, this suddenly becomes, take your kid
Like
to
a great
work
opportunity
today.
to also go to Disneyland if you decide to do that.
There you go. But that idea where is this catastrophic? No, but suddenly imagining what's my boss going to say about this? What am I going to have to do to re-engineer my day? Suddenly things can start to get a lot more upsetting. So essentially what you're doing with the and I've got to say, so the column where you're seeing some of the information that you load in around your thoughts that go through your head, it says thought distortions. I will say I don't love that term because we don't, when we're thinking about things, we're not kind of cooking up wild ideas typically, right? When we're reacting to an event. By and large, our thoughts tend to make a lot of sense to us, and we might even look for additional information to confirm that the way we're thinking about this is indeed correct. We might kind of sift through other points of view. So I almost feel like it's a bit of a misnomer to think of this as thought distortion, as much as it's helpful to think about, is this unhelpful thinking? Is my line of thinking actually getting me where I need to be emotionally? Or is my line of thinking potentially part of what's getting in the way of me living the way I want to? So not that you're kind of radically off base, but does it need a little bit of re-examination or exploration? So essentially now what kind of is in your workbook in front of you or up here on the screen is a completed table once you've started to kind of streamline each of these parts about the different areas of your experience, in this case having a laser ablation surgery, and then feeling kind of lonely, flat, like dull from it afterwards, and having that experience of that being really disappointing, if not worrisome, or even scary. Did this actually work? How much am I going to have to do this again? That type of thing. So you've got those reactive thoughts. You've got the physical sensations down, the who, what, where, and when. Next, what we want to do. Oh, I jumped way too far ahead. My goodness. Whoa, talk about racing to the end. Well, you're going to get a nice little, there you go, a nice little preview of the rest of what we're up to today. So let me just make sure I'm back to where I wanted to be. There we go. Okay.
I think we were on the summative slide.
Were we? Bear with us, folks. Nope, we started there. Okay. The idea with the thought distortions, even though, or the unhelpful thinking, I like to think about it, is by and large, most of us, if we kind of really spend some time getting down onto paper, what are these automatic thoughts I'm having? A lot of them fall into certain categories. They might be things like black and white thinking, or we call it all or nothing thinking, where let's say I've decided that I want to, I've got some bad news from my cardiologist and it's time for me to take up an exercise program. And I've decided that I'm going to start walking 5 days a week, and I set that goal for myself. And I come to the end of the week and I made it out 3 times to walk rather than 5 to 7. And I decide I'm a total failure. Right? Kind of extreme, right? That I either rocked my goal and I went every day that I said I was going to, or no matter how much I went, I failed. So that kind of black or white or categorical thinking is how we think about it too. Sometimes at school that can be something like not preparing well enough for an assignment or a test and getting a lower grade than you wanted, say a B minus or a B, and deciding that you're a failure because you didn't get the A. It's very kind of polarized type of thinking. So that's one area where our thinking can get us into trouble. Another one that I'll pick on a fair amount because it shows up a lot in my work with people living with epilepsy, and I don't want to diminish the challenges that come with living with this chronic disease, but it is an if-only type of thinking where we convince ourselves that if we didn't have this one problem, everything else would be fine. So a lot of times that can show up in if only I didn't have epilepsy, then I wouldn't have all of these problems around here. And it kind of blows over the idea that life is full of challenges, right? Not to kind of gloss over living with epilepsy, but that there's ups and downs in life, and that they're going to be related to a variety of things, some of which aren't even under your control, much less just because of epilepsy. So what we like to do in this portion is really start to get into what are some of these thinking traps. Can you identify the thinking trap that you've gotten into? You're hearing us talk about, is there a thinking trap that I might have gotten into with my disappointment from my surgery? Okay. Okay. Uh-huh. Mm-hmm. Brilliant example. Yeah. Either totally gone or it's going to be the way it was. And you're talking about, really, it sounds like you had to be so patient through these weeks of letting some of that come back online. Yeah, okay. Do other folks have either questions or examples that are coming to mind as we're talking about this?
And we do want to try and make it as interactive as possible. So if anybody has a thought or an idea or a question, feel free to raise your hand or shout it out.
Or even a yeah, but.
Yes.
Okay, so thank you for giving us, that additional input, right? So that ability to identify, is my state of mind here lining up with one of these traps? Am I getting kind of pulled into a line of thinking that might not really be in my best interests or what kind of is in alignment with how I want to be doing emotionally? So we go through in a session the descriptions of a lot of these, and also this is a workbook that people get to take so that even weeks from now when they're out of the program, they can go back and use this as a reference to kind of look at. Did you have a question? Yeah, yep, thank you.
Well, don't have much of a short-term memory anymore, so.
Right, yeah, so the memory impact. Yeah, yep, absolutely. And I appreciate you bringing that up because what we've done sometimes in groups, especially where memory is impacted for people, is we tell them bring a family member along. So thinking about somebody that was in our group that brought her husband with, he was her note taker, and so she could listen, and absolutely. Yeah, so you have this as a reference. So then what you've got kind of at the end of this process is your full thought record or diary that's kind of in a linear fashion now, showing the path of your experience, right? Going from the surgery and how that felt emotionally and physically, and some of the ideas that may have gotten carried away for you, whether that was the black and white, the all or nothing, oh my gosh, my vision's done for, or this is going to be a success, or this wasn't worth doing if it doesn't take away all of my seizures, or some of the thinking that can get going there. So we come now to the crux of the situation, which is when we've identified those challenging thought patterns, we want to see what we can do to change those. Because the idea is, if I can shift my perspective, if I can look at something more realistically, if I can see the favorable stance to impact how I'm doing emotionally, right? Takes me out of this pit of despair that this surgery was a failure to, oh, wait a minute, some of my vision is coming back online. Oh, yeah, my friend David did email me the other day and ask me how things are going. I do have friends that care. It was just feeling in that moment like nobody was listening to me, or that kind of thing. So here again, there are really important questions to ask oneself. Again, we don't just kind of come by our thoughts by way of random happenstance. We think, because these are tied to beliefs that we have, they're tied to what we've observed. And so do we need to maybe step back and ask ourselves some questions? What would I say to my best friend who'd been through an epilepsy surgery and was disappointed with the experience? Yeah, go ahead.
I always say control what you can control.
Beautiful. Yes.
You can spend all day getting up to the things you can't control and something will help you. But just control what you can control, and that's all you need.
Brilliant. You're so right. Yeah, you're so right. So I can't control what the surgeon did. I can't control if my friends contact me, but I can control what I'm thinking about and what I'm focusing my attention on. Yeah, thanks for that. That's spot on. So sometimes it can help us to either say things like, what's in my control here? What can I do about this? Or what would I say to my best friend if they were in this circumstance? Or is there, like, what proof do I have that my surgery was a total failure? Versus what proof do I have that there are some positives that came out of this, or that it wasn't a total failure, right? So sometimes it's looking at, are there other sides to this? Is there something about this that I haven't considered maybe that I should? So we've got kind of a list of questions that, again, you can refer to later to come back to, and how do I kind of test myself a little bit with my own thinking? So again, now the way this looks is we've got 2 more columns brought into our diary because we have the event, we have those reactions that maybe were getting in our way and the emotions that came from that. Then we have our, I call sometimes our replacement thoughts, our new ideas, our reconsiderations, so we want to write those down. And then, as Beck was describing earlier, we want to then log the new emotion and the level of intensity around that. So as you considered, if I can put you on the spot one more time, you've been such a great sport. As you considered, some of my vision is okay. It may not be if I try to kind of get into my periphery and see my hand here, but I can see all of this. Emotionally, how do you feel when you start to see things in a more nuanced? You feel more whole. I love how you put that. Yeah, there's way more here than, yeah. Maybe feel more hopeful? Okay. Okay. Okay, so it's not as bad as I was supposed to be ready for. That's great. That's great. Thanks so much for giving us a real and I think just more relatable and tangible experience than being late for traffic.
Yeah,
which
that
is
was
what
going
you
to
were
be
gonna
our
get from
original
me.
example, sitting in traffic, which can also be relatable for many of you as well. But
And we were kind of joking before this of, is it fair to ask people about stressful events when we're sitting in the happiest place on earth? But thanks for rolling with us here. So essentially, just to give you kind of a real tangible summary of this, the idea is that when we run into stumbling blocks in our lives, negative experiences, emotional challenges, if we can break this down into the event, so what happened, what were the automatic reactions we were having, and what were the emotions we were having, our best chance, the thing we have the most control over, is looking at our thought processes. We can't really change how we feel just by spontaneously trying to fabricate emotion, but we really can get it how we feel by reconsidering our thoughts. So that's a little kind of sampling of what happens in PACES. It's a much smaller group, although we're really excited to have so many people in this room. And there's, we get some additional dialogue going after this about the different examples that folks have brought up. And so there's a real chance for back and forth and getting some mutual benefit from each other, because even within a group of, say, 7 other people, you're going to get different perspectives about a problem you've just described in the group. I'm going to stop this here, though, because we've got some fun stuff to talk about with how we've adjusted the program for teens. We want to give you some information about how to find a PACES group, or even how to become a PACES facilitator. Do you want to talk about some of those parts? Cool. Yeah.
Yeah. Is there a question? Okay.
I find the description potentially shaming. Have you considered rebranding distortion?
Yes, absolutely. I totally agree with you, and so I thank you very much for asking the question. Yes, absolutely. So the question was, I find the term distortion, like thought distortions, potentially shaming. Have you considered rebranding that? Absolutely. So the way I like to talk about it with people is either stinking thinking, right? So it's thinking that's not working in our best interest, or unhelpful thinking. I agree with you, so thanks for making that observation. Let me move out of the way.
You can certainly rebrand it in your own mind when you hear those things. I really love unhelpful thinking, because really it's helping us take note of the thoughts that aren't really helping us to get to our goal or our endpoint, or really helping us to see logically ahead of us. So I really love unhelpful thinking. Here is just several locations across the United States that offer the PACES program for our adults. And so you can see there are community-based sites, and there are also medical and clinic-based sites. However, we are open to any potential facilitators. It doesn't necessarily have to be an advocacy group or a medical site. If you know of anyone that wants to participate or run a PACES group, please let us know. We're open to new ideas, and we really want to get the word out there to folks on how they can manage their epilepsy. All right, so this was studied in adults with epilepsy, in vets with epilepsy, right? We also studied it in some adults that lived in rural areas and are Spanish speakers that have epilepsy. And so the next special group that we wanted to kind of take on and help support are teens with epilepsy. And so what was really great, it was the first portion of our study, was that we had done focus groups with teens, just like yourselves, across the United States to give us input on how they wanted this program to be run. Erica was exactly correct, where oftentimes the healthcare group might develop a program for people with epilepsy. However, it's not necessarily what the patients want or need per se. And so what's so great about the PACES program is that it's really informed by these individuals, these people with epilepsy. So, all right. So we are looking for teens that want to participate in this study, because you can help inform us on whether or not this program is relevant to your situation, if it's going to help other teens with epilepsy. And what we've done is, and I think it's in the next slide, we've really condensed and we made the content relevant, developmentally appropriate for our teens with epilepsy. This is kind of a really big time before transition of care. And some folks don't like the word transition. Some folks really, really like it. And it's a time when you are moving into your adult epilepsy centers. And what's really great about this teen time is that you get the chance to practice these skills in the clinic with your practitioner, with your parents, but really kind of have endpoints on what it is that you want to practice in the clinic, for example, right? So we're going to talk about side effects associated with medications that you might be taking. And oftentimes, our parents are really great historians, right? They can give the history, they can tell the practitioner what you've been experiencing, but you also want to be able to practice relating that information to your healthcare provider, because guess what? In a few short years, you might be having to do that on your own, and you want to make sure that anything that you're feeling gets relayed to your provider. Also really important, you guys probably noticed this, the time that you have with your practitioner is so fast, right? It's like 15 minutes, not even. And during that time, you're thinking, gosh, I had all these questions and I didn't really get a chance to talk to my doctor or my provider about these issues that I've been having. But it really helps you hone down on the important things that you want to hit on during that visit. And that might be something that you talk about with your parents. These are things I really want to talk about with the provider. And so this is our opportunity to do it together. This might be what you're going to talk about with them, and these are the things I want to talk about with them. So having the self-management program, knowing the different educational components will help you communicate better with your healthcare team. And as you move into your adult epilepsy group, it'll help you communicate better with that team as well. All right, so this right here is the content of the teen manual. So epilepsy and medical issues, my health and well-being, dealing with stress and the blues, compensating for cognitive challenges, effective communication about my epilepsy, my community, and navigating my epilepsy care. So the design of the study is that we are looking for teens between the ages of 14 and 18 years of age. And then once you enter the study, then you're going to be put into a group of 14 and 15-year-olds or 16 to 18-year-olds, because we know some of the challenges from our focus groups that our 14 and 15-year-olds are different from the challenges with our 16 to 18-year-olds, right? Like one of the biggest things is driving, or will I be able to drive, or transportation, things like that. That obviously our 18-year-olds might be thinking of, or moving into college or vocational institutions, things like that. So what's also really great is that you have the opportunity to connect with other teens with epilepsy. And so our groups are pretty small. They're between 6 to 8 participants per group. And that entire 8 weeks, you are learning from one another, you're talking with each other, and the hope is that you feel comfortable with sharing some of your goals and some of your challenges. It's going to be led by a epilepsy specialist. So during our research project, it's going to be our neuropsychologist, Erica, and also a peer facilitator. So we will be using a young adult with epilepsy, someone that our teens could look up to, could ask advice from. And I also wanted to make the pitch. If you are a young adult, not between the ages of 14 to 18 years of age, and you're interested in being a facilitator for PACES, please come let us know, because we are always looking for our facilitators. And it might be a little tricky finding that particular age group, the young adults. And so if you know of anyone, please have them contact us. So right here is the QR code to the study. If you scan that, and please do scan that, it's going to take you to our landing page where we're going to intake some information, and then someone from our study team will call you, and then we can get the process started. Or if you want to look at the study, we have flyers in the back. On there is our study website, and so feel free to take a look at that. Oh, that you're right.
Excellent.
Yeah, great.
Yeah, that's perfect.
Yep. So on there, actually, yes, question. Oh, great question. I think I know. Is it done via video? Yes. Yeah, that's an excellent question. So these aren't live. These are going to be done via Zoom. And so that allows us to have teens to participate from all sorts of areas. Yes.
Are there any plans to scale for younger I know that's a whole different research conversation, but is there a possibility?
Totally, and with funding, yes, now, have grant will work,
Right.
yes, absolutely. And actually, I mean, we're here at this stage because so many people love PACES and said, "What
Please, can we have this for teens?"
Please, our teens need this, and luckily, we had some grant funders that were responsive, so, yeah.
But actually, that brings up a really great point, because when we had developed the teen manual, we found it's kind of a different beast than the adult manual.
Yeah, it's
It's a-
very different, and like, as a matter of transparency, we did a lot of thinking about whether there should be a coordinated group for parents, and, you know, sometimes with science, to get things going, you've got to start simply and then build from there, but a lot of thought has got into how do we, epilepsy is not just an individual thing, it's a family thing, and so how do we think about that and effectively deliver programs? Yeah, thanks for asking the question.
So I'm going to stop right there, because I hope we have more questions, but I'll also leave our QR code up. Whoops.
Yes, more questions or comments, or yes, go ahead. So, thanks for asking those questions, because I was about to say the training is free. So if you want to be trained to be a PACES facilitator, that's free. Most of the sites that you saw on the map implement the program, like say at the Epilepsy Alliance of Louisiana, for no cost to folks. So it varies depending on the site, but in the main, a lot of these are groups that people try to bring to folks free of charge. Yeah. So there was a Managing Epilepsy Well landing page on one of the slides. You can go to managingepilepsywell.org, and there's a drop-down menu for all of the programs, PACES, as well as the other programs that we listed. You can navigate from there to a contact us form, and you can contact, and those land in my email inbox for PACES. So you can reach out either to find out about how and when to get trained, or how to get matched to a PACES group so that you can take the program yourself as a consumer. Yeah.
So when you match for that demographic, because a 23-year-old, obviously adult,
Right.
different issues than a 43-year-old, just like they're not quite teens,
Yeah.
but they're maybe not on their own yet,
Oh, it's at the bottom.
supporting themselves.
No. And I will tell you, based on experience, that one of my favorite groups had a 21-year-old and an 89-year-old in it, and and it was really pretty cool. With the teens, we do, but with the all ages adults, it's kind of amazing the synergy of discussion and relatability. Yeah, so we decided not to slice things up too much. You're asking an interesting question. When we've done analyses on who benefits from the program, age does not, it turns out that age statistically doesn't have any relationship to how much people benefit from the program. Yeah.
Great. Any other questions? All right, so Erica and I will be around. There are more flyers at the UCLA booth. I'll probably be around the UCLA booth if anybody else has any questions. Or if you do and you see us, please stop us. Please, please, please. We're happy to answer any questions.
Thanks
All right,
all. It was
thanks,
really fun to
everyone.
talk with you. Thanks.